Hi, this is Dr. Dumestri. So thank you for this question. So this patient has had a cosmetic breast augment, so an implant placed under the muscle. So this is the diagram. You've got the breast envelope, we've got the breast gland here in yellow, we've got the pec muscle from the side view, and the implant is sitting underneath, giving her that volume. Now, unfortunately, years later after her augment, she was diagnosed with a breast cancer and now needs a mastectomy or removal of the breast gland to treat this. And she's seeking implant reconstruction. And her question is on what happens to the muscle. So nowadays, when we're doing implant reconstruction, the trend is more and more towards putting the implant above the pec muscle. So the opposite of what you see here, the implant sits on top. And the reason for that is to prevent animation and discomfort that is associated with that. So in this case, when it's a cosmetic augment, you've got all of this breast gland, often extending all the way up here. And so when the muscle contracts, it's no big deal. You do see your implants bounce, but it's not a huge issue. Now, in the reconstructive setting, when you have lost this breast gland, so mastectomy means your general surgeon's going in, taking out the breast gland. Now you just have a very thin coating between skin and where the implant is sitting. So the animation can be quite extreme, very deforming, meaning anytime you move, flex those pec muscles, you get very significant deformation of your implant. So when you've already had a subpectoral implant, what happens at the time of mastectomy? Here is the situation. So the breast surgeon goes in, they core out, remove this breast gland, and I remove your implant. So now this muscle is just kind of flapping there. It's got no home. Now, because I still prefer to put the implant above the muscle, I repair the muscle back down to your chest wall. These are little stitch marks. That's now anchored back down. And then your implant goes above the muscle. And then this surrounding it is just a very thin layer of ADM or acellular dermal matrix. You can check out one of my previous videos to see what that's for. Hope that helps. It's a pretty common scenario because breast augments are very common, and so is unfortunately breast cancer. This is how we deal with it. Get you back to your anatomic position. Proceed as usual for a prepectoral above the muscle reconstruction. Have a great day.